Welcome to the Occupational Health Department. I'm just here to let you know of a number of services that are available to you as human and healthcare students within the university. There are a couple of options available in terms of how we may support you, and it may be in relation to any ill health requirements which may be impacting upon your ability to undertake your work placements and studies. By this we mean we may offer advice in terms of recommendations and adjustments to your course tutors and yourself. There is also a number of vaccinations that are a requirement which is underpinned through the Department of Health guidelines. We ask you to provide a variety of documented evidence piece materials to support this. And if you're not able to provide those pieces of material, then again we can offer the necessary vaccines. What we do ask is that you're able to provide evidence of having chickenpox here within the UK. If you're not able to, there is the varicella vaccination which is available to you. We ask that you're able to provide evidence of 2 MMR vaccinations, which is mumps, measles and rubella. Again, if you're not able to provide that evidence, we can provide the vaccine. And there is also the requirement to have 3 hepatitis B vaccinations, followed by a blood test to check your immunity levels. Again, some of you may have had part vaccinations, some of you may have had none. Either way, we can ensure that you meet the standards by having the full course. In terms of what we refer to as exposure-prone procedures, that is EPP, that refers solely to the midwives and operating department practitioners. So for you guys, there is a separate screening in terms of blood-borne virus screening. So for this, we will be checking for hepatitis B, hepatitis C and HIV.
We use an independent database specifically designed for occupational health departments. This database is confidential to this department, so cannot be accessed by yourselves or your tutors and is not linked to any other university system. This means it's your responsibility to update the occupational health department if you change any of your personal details. Once you've completed all your vaccinations with us, you can request a copy of this information. Once you have a copy of this information, it's important that you keep it safe, as there will be an administration charge if you need to request it from us again.
Your appointments are made with your tutors. This may mean that you have to attend university, especially for your appointment. This is to ensure that you don't miss any important lectures. We will send a text message reminder of your appointment the day before. Last year, 200 appointments were cancelled and rearranged, and over 300 were not attended. If you do not attend your appointment, this can result in your tutor removing you from placement. If in the event you are unable to attend your appointment, we ask that you contact your tutor or somebody related to your course to obtain authorisation for us to move your appointment.
Just going to touch about contamination incidents. Contamination incidents can put you at risk of blood-borne viruses such as hepatitis B, hepatitis C and HIV. Examples of contamination incidents are blood or bodily fluids splashing in the face, so in particular eyes, nose, mouth, catching yourself with a needle, cutting yourself with a suture blade or getting contaminated blood in an open wound. To try to avoid contamination incidents, wear any protection provided by your placements such as gloves or eye protection. Dispose of sharps such as needles and suture blades straight into a sharps bin. Don't leave needles lying around or any other sharps lying around. And finally, don't resheave needles. By resheaving, I mean don't put the cap back on the needle once you've used it. When you're starting your new placement areas, it's important you make yourself aware of their contamination incident policy and follow this should you have any contamination incidents. However, a general overview of what you should do is bleed any wound that you get under running water and wash it with soap. Do not be tempted to scrub the wound and don't be tempted to suck the wound either. When you have finished washing your hands or the wound area, please dry it carefully and apply a waterproof plaster or dressing. Once you've done all of this, please seek medical advice. This would normally be at the Occupational Health Department within your placement practice area. If it's out of hours though, you would need to go to the A&E department. And finally, it's important that you let us know at the university that you've had a contamination incident so that we can do any follow-up care.
So we'd just like to thank you all for listening, and we look forward to working with you in the near future.